What time is it? Say it's time for KP's Video News. KP's Video News. It's KP's Video News, y'all. It's KP's Video News, y'all. It's KP's Video News, y'all. KP's Video News, y'all. That's right. We melanin strong up in here. All up in here. What's up, folks? I'm gonna bring some good stories to you today about what's going on in the world and how it affects us. How it affects us on a daily basis. And I'm gonna jump right in because I got a lot of stuff to cover here. And the first story is how racism in the U.S. health system hinders care and costs lives of African Americans. As the pandemic swept across the United States, the virus hit African Americans disproportionately hard. African Americans are still contracting the illness and dying from it at rates twice as high as would be expected on the share of the population. In Michigan, African Americans are only 14% of the population, but account for 1/3 of the state's cases and 40% of its deaths. In some states, the disparities are even more stark. Wisconsin and Missouri have infection and mortality rates 3 or more times greater than expected based on their share of the population. Speculation has suggested these disproportions are due to several factors. African Americans are more likely to live in poor neighborhoods, work at risky occupations, and have more underlying health conditions and limited access to health care. But similar inequities exist in African American communities with above average wealth and health care access. Staggering COVID-19 rates occurred in Prince George's County, Maryland, the nation's wealthiest African American enclave. Comparable white communities were relatively unaffected. As experts in clinical psychology and psychiatric nursing, we know that this elevated risk for African Americans is not uncommon. It is true regardless of income, education level, or health care access. It is true for other things besides COVID-19. African American women are more than twice as likely to die from childbirth than white women. Even if the African American women were educated and wealthy, they were more likely to die from childbirth than uneducated, poor white women. Racism, the root cause. An analysis by the National Academy of Sciences found African Americans receive poorer quality care than white patients across all medical interventions and routine health services, even when insurance status, income, age, and morbid conditions and symptom expressed were equal. Expert point to racism. Let me say that again. Expert point to racism as a root cause for these disparities. Indeed, the American Academy of Pediatrics has outlined how racism impacts health outcomes for African American children. We suggest the same is true for COVID-19 outcomes among African American adults. Other barriers negatively impact the health of African Americans that include implicit bias, attitudes, thoughts, and feelings outside of conscious awareness as patients and providers communicate with each other. Implicit bias from a doctor or nurse affects the quality and quantity of information shared with the patient about health conditions and treatment plans. The worst case scenarios, when providers withhold critical information about a health condition, when they don't include the patient's voice during decision making about care, and when they don't refer the patient for further tests or specialty care. Implicit biases from healthcare workers can result in patients being less likely to understand their health conditions, which is necessary for patients to manage an illness effectively. Adverse interactions, when physicians lead to long-lasting consequences for patients, including unequal treatment and disparate health outcomes, and when it comes to ineffective patient-provider interactions, African Americans suffer the most. The location of hospitals, clinics, and other healthcare facilities are often a barrier to care. Transportation or lack of it impacts the patient's ability to receive services. African American patients have noted the frustration when healthcare facilities are not close to their homes. To get there, many of them rely on public transportation. The result, missed or canceled appointments, sometimes due to policies regarding late arrival times by patients. Differences also exist between African Americans and white patients in the length of wait time for appointments and the ability to schedule follow-up appointments. This can result in delayed health care, which leads to poor health outcomes for illness, including COVID-19. Recommendations for addressing this racism. Consumers who are well informed about their health and confident in managing their care have better outcomes virtually across the board. Cancer, diabetes, cardiovascular disease, and mental health conditions such as schizophrenia. That said, here are 3 recommendations to address racism and to reduce racial disparities in healthcare services. 1. Healthcare professionals need to become more aware of their implicit bias. Identify the problem, as the saying goes, and you're halfway to solving the problem. One way to become more aware, take the implicit bias test. 2. Doctors and nurses need to be attentive and collaborative when communicating with patients. Empower the patient by encouraging questions and letting them express opinions. When patients believe the providers are there to support them, they manage their illness better. They also have a better perception of quality care. Ultimately, this leads to improved health outcomes. 3. Hospitals, clinics, and doctors' offices should provide more flexibility in delivering services. Telehealth, when doctors and patients communicate online instead of an in-person visit, should be one of those services. They should also restructure scheduling policies, emphasizing shorter wait times and more slack if patients are late. And health inequity of African Americans is not a new phenomenon. However, COVID-19 shined a light on the problem. Racism is not isolated to healthcare services, and it remains pervasive throughout our society, but by making the tangible steps outlined here, providers can begin to solve the problem. So we need to get busy on that. We need to get busy on that right now. And so part 2, the Americans are asking how to erase racial health gap. A community development leader may have some answers. And a new Southwestern University study strongly estimates that for every $1 of accumulated wealth that white families have, the average black family has 1 cent. The average Latino family have about 8 cents compared to the dollar that the average white family has in accumulated wealth. To erase the racial wealth gap in the United States is an urgent imperative and requires a fundamental shift in the financial ecosystem. Across the nation, community development financial institutions have played an important role to provide loans and to support to businesses and individuals with difficult access to finance. Moving from your money from a large contracting institution to a local bank, credit union, or is one of the most important steps to each one of us. Those who see themselves as investors or not can take to solve some big aspects of racial inequality in finances. Capital Good Fund is a nonprofit CDFI founded in 2009 has been working to erase the racial wealth gap. To truly and honestly address racism in America, we need to ensure that the financial system ceases to shackle communities of color with predatory loans and to exclude them from the access to affordable mortgages, business and auto loans, and other products. Over the past 11 years, they have helped more than 5,000 low-income families with roughly $4 million in interest and fees compared to predatory products, while increasing their FICO scores on an average of 90 points. Providing liquidity is critical. Lack of liquidity, savings, home equity, and others forces low-income Americans, families in need of short-term capital to turn to payday lenders, pawn shops, rent-to-own stores, auto title lenders, and others. Our goal is to put these companies out of business, for they disproportionately target communities of color, immigrants, veterans, and other vulnerable populations, charging triple-digit interest and reaping massive profits. That's those payday loan people. Payday loan people and those people where you take your title of your car and you get a loan off of them. Stay away from them. They're criminals, and they're definitely charging you 10 times more, man, in interest than any place else. Since the COVID-19 crisis began, Capital Good Fund has seen more needs among their clients, and they have granted nearly 400 COVID-19 relief loans of $300 to $1,500 with the 5% APR and a 3-month deferment period, and to put 10% of its active borrowers on deferment plans. The stimulus checks from the government are nowhere near sufficient to empower the people who are struggling in this crisis. People need access to equitable credit, and a diverse team and a client base go hand in hand. 40% of Capital Goods Funds borrowers are Latinos, and 40% and 25% are African Americans. This has pretty much been the racial makeup since we started. Equally important, our staff is extremely diverse, from frontline employees to our executive team. 66% of the staff is female, 65% of the staff are people of color. During 15 years in the corporate marketing world, improving the lives of individuals often came second to profitability. However, they're doing something good out there, and that's called a Capital Good Fund. Let me see if I can find a where you can locate them. Where's a web page? I don't see a web page for them. I'll find that out, but I'll write the name of it in the header, and that's the Capital Goods Fund, and it's a pretty good. It sounds pretty good. They're doing things to help people that are in need. It's a non-profit organization founded in 2009, and they have been working to erase the racial wealth gap. That's a good one. And speaking of gaps and debts, an overdue debt, why it's finally time to pay reparations to Black Americans. Four alarm. It's a four alarm. That's right. It's a four-alarm fire on this one right here, boy. Over 400 years ago, the first slaves were brought to the land what eventually become the United States of America. And in the intervening years, the country was created, divided, reunited, and reconstructed. And it became one of the most powerful nations on the planet. But it has never truly compensated those individuals who literally grew the nation and whose ancestors suffered from generations of anti-black policies. Now it must. If there's anything the past several months has taught us, America cannot ignore its past. A nation founded on the premise of liberty and justice for all has failed to deliver that promise. There has not been true justice for Americans who are black, and particularly ancestors of slaves in America. The unjust enrichment that the United States received from its slaveholding past, valued at over $3 billion in 1860, has compounded exponentially since then, never been recompensed. Beyond America's original sin of slavery, the systems of institutional racism, income inequality, and police violence that continue to prejudice black citizens following the Civil War have never been fully addressed. This is why the streets are full of protests. It's not because of pent-up frustration about a pandemic or sudden anger at police violence. It's because of an unfulfilled promise of unserved justice. The argument for the payment of reparations to Americans who are the descendants of those who were enslaved is nothing new, but it does take a new urgency in the United States come to terms with this legacy of racism in the aftermath of the recent deaths of George Floyd, Breonna Taylor, and Ahmaud Arbery. Even before the recent protests, the pandemic laid bare the truth. Black Americans suffer not only from vast amounts of income inequality and racial injustice, but also from disparities in health and well-being. While the marching on the streets has made Americans awareness of impacts of systematic racism more acute, The truth is that the country knew what it was responsible for. It just refused the moral courage to make the necessary reparations. The moral justification for reparations stands on its own, but the evidence of the wide income inequality gap between white and black Americans also demonstrates that reparations are both necessary and needed. Based on research by the Brookings Institute in its policy brief titled, Why We Need Reparations for Black Americans, the average white family possesses approximately 10 times the amount of wealth the average black family, and white college graduates have more than 7 times the wealth of black college students and graduates. Additionally, there is a huge disparity in the amount of student debt owned by white and black individuals. According to the same research by Brookings, 40% of blacks compared to 30% of whites in the 22 to 55-year-old range have student debt. And black individuals have approximately 50% more student loan debt than white individuals. Disparities in home values, business investment, and the cost of unjust incarceration add to the toll of what the legacy of slavery and anti-black policies have on black families in America. There are claims that America can't afford to pay reparations, especially now, but it is precisely the moment in history that shows America can repay what it unjustly received. The federal government, in the span of just weeks, approved over $2.3 trillion in stimulus funding to support the American economy. And that doesn't include the almost $4 billion the Federal Reserve spent endeavoring to do the same. The actions and their eye-popping amounts demonstrate that the funds are available when the urgency demands it, even if it means increasing the national debt. History has also proven the willingness of America to spend when it needs to address the hardship of its citizens. During the New Deal of the 1930s, the United States spent an equivalent of approximately $20 trillion, take that correction, $50 trillion in today's dollars to help the nation rebound from the Great Depression. After World War II, the U.S. paid over $1.5 billion to Japanese Americans who were detained in internment camps in compensation for the inhumane policy of the nation. The spending hasn't only been domestic. America spent trillions of aid dollars rebuilding nations around the world following World War II and other wars in which it was engaged. So, if it's not the ability to spend the money, what is it? Some might say the logistics of reparations are too complicated. Who would get the funds, and how would they get them? Would they be in the form of cash payments or credits, or perhaps specified programs targeted to black individuals, such as free college tuition and other programs to help bridge income inequality? These are all challenges that can and should be solved. If America can fly humans to the moon, it can find ways to redress the injustice of people who toiled on its own land. The enterprise of slavery that shackled 12.5 million black individuals, and the succession of the anti-black policies that discriminated against their descendants for generations, are finally being understood for what they are: a stain on the fabric of the nation that has not yet been atoned for its past. At this moment of national introspection, merely learning about the past and apologizing for it is not enough. America must finally settle the debt that it has long owed to black Americans, and to do so with the full faith and credit of the nation that enslaved their ancestors. Hear, hear. 4-alarm. That's right, it's a 4-alarm fire out there, doggone it. It's time for y'all to pay up. Pay us what you owe. You owe. You've been cheating us and ripping us off, man, and treating us like animals for 400 years. And this country was built off the backs of the African roots. And hey, it's time to pay up. It's time to pay up. You know what you owe, and you know you got it. You know you got the money, because anytime you can just pop up and say, oh, we're just gonna pump a couple of $1 trillion into the economy and send everybody a $1,200 check in the country. But hey, Y'all could have did that for reparations a long time ago. And another thing a lot of black people don't understand and don't know about that whole issue about the 40 acres and a mule. Let me tell you something. From the time, the 1860, 65, up until the year of 1970, those 40 acres that was always been talked about was available to you. Available to you. Guess who got it? Who got the 40 acres? Any white family that went forward and asked for that land got the land. They wouldn't even inform you of where to go to get the land. They wouldn't even inform you that the land was even available. I just recently found this out. They used up all the land that was allocated for us. The 40 acres that was allocated for us, they gave that land to white farmers in the United States from 1865 all the way up until 1970. They run 1970s when they passed out the last 40-acre plot. So, you know, it's a terrible situation. But anyway, this is just a little quick one I'm gonna throw in here right quick. The House fires back at Trump, Idiot 45, by passing Obamacare expansion. The House on Monday decided to do a little something. They decided to do a little something there, and what they did was they passed a bill to expand the Affordable Care Act as Democrats seek to hammer Trump and the Republicans on health care heading into the November elections. The legislation, which passed by a largely party line vote, 234 to 179, would increase the 210 health care law subsidies and help people afford their premiums and add more federal funding to for Medicaid expansions. Democrats timed the vote to contrast with the Trump administration legal brief that they filed with the Supreme Court last week, calling for the Affordable Care Act to be struck down, and a move Democrats say would be even more harmful during the coronavirus pandemic. I mean, just think about it. How rotten of a person do you have to be to want to try to destroy? I'm talking about Trump now, wants to dismantle and destroy the Affordable Care Act in the middle of the coronavirus pandemic. This is what he's trying to do, and this is what he's in the process of trying to do. He's brought it up in the Supreme Court, wants to get rid of the Affordable Care Act. So you talk about millions of people are going to lose their health care in the middle of the worst crisis healthcare crisis that the United States has ever encountered since the Spanish flu of the 1900s. Go figure. Get out. I'm telling you now, folks. If you never voted before, just go down to the DMV and get your ID card and register to vote. You don't have to get a driver's license. You can get an ID card, and while you're there, sign the paperwork so you can get registered to vote. Because November comes up, it's time to give the DC dunce his walking papers, man. He got to go. With all the stupid stuff he's doing, it's time for him to go, man. It's that time. What time is it? Say it's time for KP's Video News. That's right. KP's Video News. It's KP's Video News, y'all. It's KP's Video News, y'all. That's right. It's KP's Video News, y'all. That's right. It's KP's Video News, y'all. Peace.